Today we're diving into one of the most significant complications of diabetes. It's a condition that can silently creep up and damage a person's eyes, and it's actually a leading cause of blindness in working-age adults. We're talking about diabetic retinopathy.
And let's be really clear about the scale here. This isn't some rare, fringe side effect. We are talking about the #1 cause of new cases of blindness among adults who are still in their careers, raising families. You get the picture. This shows you that this isn't just an eye problem. It's a systemic disease that is playing out in the incredibly delicate tissue at the back of the eye.
So, this brings us to the big question, right? How on earth does a disease that's all about blood sugar launch a direct attack on our vision? What's the connection? How does a metabolic problem spiral into a full-blown crisis for our eyesight? Well, that's exactly what we're going to unpack.
All right, here's our game plan. First, we'll look at who's most at risk. Then, we're going to zoom all the way in to see how the damage actually starts at a microscopic level. After that, we'll cover how doctors see and stage the disease, figure out the ways vision is actually lost, and finally, wrap up with the amazing treatments we have to fight back. Okay, first up, the risk factors. Before we even get to the damage inside the eye, we've got to understand the conditions that basically put the whole process on fast forward. The story really begins long before a patient might even notice a single thing is wrong with their vision.
What this list makes so clear is that diabetic retinopathy is not happening in a vacuum. Of course, the longer you've had diabetes, the higher your risk. That makes sense. But look at the other accelerators here: poor blood sugar control, high blood pressure, even things like kidney disease and high cholesterol. It just goes to show you the health of your retina is completely tied to the health of your entire body.
All right, let's get into the nitty-gritty. We're going down to the cellular level to see exactly how this damage gets started. This is where the story really begins, with the tiniest blood vessels in the body and how they react to being bathed in a high-sugar environment for too long.
The term you've absolutely got to know here is microangiopathy. Let's just break that word down. Micro means tiny, angio means vessel, and pathy means disease. So it's a disease of the tiny blood vessels. And guess what? The retina is just packed with these super fragile capillaries, which pretty much makes it ground zero for the damage that high glucose can cause.
So here's how it goes down, and it's this kind of domino effect. First, you have these cells called pericytes. Think of them as the support beams wrapped around the capillaries. They start to die off. That makes the vessel walls weak. Then, the lining of the vessel itself, the basement membrane, gets all thick and clunky, so it doesn't work as well. This leads directly to step 3. The whole system breaks down, and the vessels start leaking fluid and gunk into the retina. And finally, a lot of these damaged little vessels just get blocked off completely, creating zones in the retina that are literally starving for oxygen.
Okay, so that's the microscopic drama unfolding. But how does an eye doctor actually see this happening? Let's talk about the clinical signs they look for to figure out what stage the disease is in. We're moving from the invisible why to the very visible what.
Broadly speaking, the disease gets split into 2 main stages. The first is called non-proliferative, or NPDR. You can just think of this as the leaky stage. Damage is happening, for sure, but it's kind of contained for now. The real tipping point is when it becomes proliferative, or PDR. This is the retina's desperate and frankly dangerous attempt to save itself from oxygen starvation. It starts growing brand new blood vessels, and this process, neovascularization, is where the most severe, sight-stealing problems come from.
And this table here gives you a peek into what a doctor is searching for. In that non-proliferative stage, they're seeing all the signs of leakage, these tiny balloon-like swellings called microaneurysms, little bleeds, and something called hard exudates, which are basically leaked cholesterol. But once you hit the proliferative stage, the whole game changes. The absolute key sign is neovascularization, those new, unstable vessels. If they break, they can cause a massive bleed into the jelly of the eye, a vitreous hemorrhage, which can just wipe out a person's vision overnight.
And that leads us to the most crucial question of all. How does this whole process actually make someone go blind? What are the final events, the pathways that ultimately rob a person of their sight?
Now, while those big, dramatic bleeds are absolutely terrifying, the single most common reason people with diabetes lose vision is something called diabetic macular edema, or DMO. This is what happens when all those leaky vessels cause swelling right in the dead center of your retina, the macula. That's the part you need for all your sharp, detailed vision. And the really scary thing about DMO, it can happen at any stage of the disease, even the early ones.
But that brings us to this quote, which is so important. This is the message of hope in all of this. It says loud and clear that severe vision loss is not a foregone conclusion. It's not inevitable. If we can catch this early with regular screenings and actually use the treatments that have been proven to work, we can dramatically lower the risk.
So what are those treatments? Let's shift gears and talk about the modern tools we have in our arsenal to fight back against diabetic retinopathy, the medical and surgical interventions that help us hold the line and save sight.
And it's a pretty powerful arsenal. You've got laser treatment, or PRP. Essentially, you make tiny laser burns in the peripheral retina that starve for oxygen. It's almost like sacrificing some of the less important peripheral vision to save the critical central vision, because it tells the eye to stop screaming for new blood vessels. Then you have anti-VEGF injections. These are miracle drugs injected right into the eye that block the chemical signal that's driving all the leakage and growth. And for the really big messes, like a major bleed, there's surgery called a vitrectomy, where they can go in, clean everything out, and fix the damage.
So we have lasers, injections, and surgery. All of them are incredible technologies, but they're all reactive, right? They're treating the damage after it's already started. So what is the single most powerful, most effective treatment of all?
And here it is. This is the answer. Systemic control. It's the absolute foundation of everything. Tight, dedicated, rigorous management of blood sugar, blood pressure, and cholesterol is more powerful than anything an eye surgeon can do. It's the only thing that actually treats the root cause instead of just chasing the symptoms in the eye.
And that really leaves us with a final, sobering question to think about. Our treatments are incredible, and they're only getting better. But the number of people with diabetes is just exploding worldwide. So in the face of this massive public health challenge, is real prevention, through that systemic control we just talked about and widespread screening, is that our only true, sustainable way to win the war against this type of blindness? It's something we all need to think about. Thanks for joining me.